So, we're Macmillan Skin Cancer nurses and we work in Gloucestershire for the dermatology team. And we are scared because normally we see just one or two of you in a room, not a crowd. So bear with us, won't you? Please bear with us. So our brief is to talk about follow-up appointments for patients who have been diagnosed with malignant melanoma. Subtitled, Look, See, Touch, Feel, Hear. So that's all the things we do. As we work for Macmillan, in all of our appointments and all of our patient contact, we need to be mindful that there are 9 outcomes that matter most to people with cancer. And this has been done through a study with Macmillan, and actually we're not even expected to fulfil this until 2030, so we've got a lot of time to get better at it. But what people have said is that they need to be diagnosed early, and we know how important that is because that's the one single factor that impacts on your survival. We see a lot of things through our clinics, and some of them are very, very serious, some of them are very, very trivial through GP referral. But actually, we'd rather the GP send you anything they don't like the look at because it keeps you safe. You get to experts, and we can hopefully sort you out from there. So in our jobs, we've seen sock fluff.
I had something in a belly button that had been there for a year. When I looked closely, got some tweezers, it was just a year's worth of gunk from the belly.
And a Cadbury caramel wrapper stuck to the back of her leg. So, but we don't mind because actually those are really good outcomes. You can leave our appointments and we're all happy. So diagnosis early is super important. And it's really important that you understand all the information that we give you about your appointment, about your diagnosis, so you can make decisions that matter to you. We need you to get the treatment and the care which is right for you, for your cancer, but also in your life and all the other things that matter. And to make sure, just as all of you have said, that your family is supported through your decision making as well. So everybody actually knows what's going on. We hope we always treat you with dignity and respect. I have a filthy sense of humour, and sometimes that might be a bit difficult to accept in a clinic appointment, but Louisa will tell you of many times where patients are even worse than us. We want you to know what you can do to help yourselves as well, and being part of something like this is really empowering. We want you to reach out into your cancer communities and your local support groups so you get even more knowledge and we're not the single fount of that. We want you to have happy lives. I think the one message that we will give in appointments is please go out, have a nice life, be happy, do the things that you enjoy. And whilst we're very mindful that you have to be protected from the sun, that does not mean living in a cave or just going out after midnight so you don't get any daylight. And in some of our appointments, things don't go as you plan, and we want you to make decisions to allow yourselves to have a peaceful, dignified death supported by your family. So all of this is in like 20-minute snappy appointments. So bear with us as we go on. So the required skills to do this job are the fact that we have clinical skills, and all these skills, clinical skills, dermatoscopic skills, diagnostic skills, surgical skills, communication skills, are all audited regularly. So we're fairly sure when you come into our care that you are being looked at after by experts. And if we don't know the answer, then we will find a man that does, or a girl that does usually. We've all attended advanced communication skills, so we should be able to pick up the cues that you give us from your body language, from your non-verbal communication, to know when you're worried, you're distressed, you're just not telling us. But we know there are an awful lot of conversations, the bigger conversations, that start just as you leave the room, just as you put your hand on the door handle and go, did this tingling down my arm mean anything? Boom. That's the conversation we want you to have whilst you're sitting down. So we try our very best, and we all work along the NICE guidelines for patients with diagnosis of melanoma. So, Andy, do you want to do this one?
When they first come through to see...
You might need to go wide, love.
When they first come in and sit down, I want them to talk about anything that has been worrying them, and we discuss health and well-being and answer any questions. We had one person come in and they were absolutely loved sport, and they had the impression now that because they couldn't wear shorts, they had to not do all the things that they loved, and they felt that this diagnosis had actually ruined everything. But I just said there are lots of websites about clothes that are appropriate with UV protection, and then I contacted them and gave them those details, and that made a big difference, because we mainly want to get across the message that, like Louise said, they need to enjoy their life, and things like foods they can eat, things rich in vitamin D, and some people haven't got any idea, so we give them all the details about diet as well.
So the concerns that you bring into clinic are your concerns and not our concerns. We need you to tell us what bothers you. This is your appointment. And just like the speaker before said, tell us about your changes. That's the only way we'll get to know. And you need to be confident that when you tell us about your changes, you will be taken seriously. And we won't just go, it's absolutely fine. We will explain why it's absolutely fine. So we're looking at your skin, we're looking at your well-being, we look at your lumps and bumps, we will examine your lymph nodes, your scar and your skin. So when we assess your lymph nodes, that's what we call lymph node examination. I can't remember what it's called. We're going to assess your scar. We're going to ensure that your scar sits happily with you and that you don't have any cosmetic concerns about it. And if you do, we're going to refer you on to somebody that can help cosmetic camouflage. We have a local clinic in a little Cotswold village near us who are fantastic. We're going to offer you written information. We're going to offer you a copy of a resume of your appointment, and we're going to send that out to your GP. And most importantly for us and for our clinical team, we're going to keep accurate clinical notes. So in your notes, that's where everything that we do in the appointment is kept about you. And it is super important that we keep those up together. So whoever looks after you next time, and we try and give you as much continuity as we can, knows where we're at and what we're doing. So Lulu, do you want to do that one?
So why we do this to keep all of our patients safe, to make sure that you can also contact us in between appointment times. So if you have a concern, everyone has our numbers and email addresses, and if we can, we will try and see you on the day, or one of the team will see you within the week. We try and keep everyone up to date with all the information, so as soon as you're discussed or cases are discussed at MDT, we phone you or email you or however you want to be contacted, but also you also have our details too. It's really important that you get given a key worker, and we, as Louise said, we always try and support our patients and try and keep that key worker, because you get to know us, we get to know you, and we also really get to know your skin. When you come in to appointments, we really want you to bring up your concerns, and sometimes it's not about skin, and that's really important to us as well. So it's about the whole of you, the whole, everything, the little things, the big things, because the little things can sometimes be the big things. We also want you all to feel happy and your family to be happy with the care that you're given, and we also want you to tell us when we get it wrong, to try and make sure that doesn't happen to the next patient, because I think that's probably one of the most important things, is telling us, it could have been better.
So the other reason we do it, and I guess the most important reason to do it, is to keep you well, to check that there isn't any signs of recurrence, either locally or somewhere else. So we will ask you about your health, any changes in headaches, any chest infections that don't go away quickly, and change in bowel habit, any pain, any difficulty in any of your normal activities of daily living. But also check your skin lesions as well. So we know if you've had a diagnosis of melanoma, you are more likely to have another skin cancer develop through your lifetime. So we make sure that you're up to date with what you're looking out for, and that you can come back and see us sooner than your 3-month appointment should you have any problems. Anda will nag you incessantly about sun safety. It's her thing, and she'll bring a series of hats also to show you that she wears proudly. And it is important that you do know what you're wearing, why you're wearing it, how often it should be applied, and we use resources from Skin to support that. And we do it all in a 20-minute appointment. So, we use our communication skills, we ask you to have a physical examination, and we need you undressed down to your underwear, including your socks, and that's your socks, not our socks. So going top to your toe, we're going to do your front to your back, backs of your ears, your scalp in between your toes, and we use dermoscopy to examine every pigmented lesion on your body. And that's not every time, because as we get to know you, we don't need to do that every time, but if there are changes, we will. We're going to take measurements of moles that cause us concern, or we're going to arrange for them to be excised, and we use medical photography. So actually we do have good pictures of what you look like to hand every time we see you. So this is how for you to keep us happy. It would be really lovely if when you come in the appointment, we love being asked about ourselves, but we can gobble up 10 minutes of an appointment asking me about the kids, my frock, the dog, Big Al, my bike, anything. So tell us about you, and then at the end we can talk about us, and we get how important that shared relationship is. It benefits us all, but we need to kind of start with you because it's your appointment. For Louise's patients in particularly, we like appropriate underwear. Louise's patients would like to wear underwear because that's quite embarrassing. So when people come to us, we need to know that you're wearing what you should be wearing, so Louisa doesn't have to go and mackle up something with a towel to save your dignity. And just like Lou says, let us know when we can do better, because we see a lot of you. We can't give a standard treatment. It mustn't be like that. It has to be individual. So just give us some feedback on how we do. And please understand that if your hip replacement's being held up, we probably can't influence that, and we might ask you to go back to your GP, and we hope we don't fail you at that point. But some medical issues are completely out of our domain. We can't make everybody smilier or happier when they answer the phone. We have some real grumpy people that answer phones in Gloucestershire, but they're grumpy to us as well. Let us know, and we will try and make it better, but we're proper limited. And also by buying into perhaps support groups that we suggest, that we would love that, because there are ways of making this easier, not necessarily better, but easier for you all. Please wear sunscreen, and please don't come to your appointment sunburnt. Last week, everybody sunburnt, everybody wore sunscreen. And if you can, Tom Hardy would be lovely. It's never happened yet. Lulu?
Our frustrations are also your frustrations. We really appreciate waiting times. Sometimes we just can't, we try and come out and say if we're running late. Sometimes you just can't work out how a clinic's going to go. You could be up to date and then boom, something goes wrong, and that tends to have a massive impact on everybody else. So our waiting times, again, for us, we'd love longer for appointments to give you all the needs you need in an appointment. Because we also know that you wait 3 months for an appointment, and then to only be given 20 minutes, you've got to try and cram all that information into that time. Appointment failure, I have to say, skin cancer patients are the best at turning up. If a patient doesn't attend, there is normally a really good reason why they are not there, and it's normally because they're either on holiday or they haven't actually been sent the appointment from booking. So I absolutely hate it when a DNA letter goes out to a patient and they ring up like, oh, I didn't even get an appointment. So I don't like that system, and I'd love to change. I don't know what you all think about that, but I know that everyone pretty much always comes to appointments, and there is normally a valid reason. Short appointments, I wish, like I said, our appointments could be longer. I wish we could support you in other appointments as well, and that's again something that our trust are looking at to try and see if we can get into other appointments that are really valid to hopefully give you some more input. Being late for appointments, that does happen quite a bit, but that tends to not be our follow-up patients. That tends to be our 2-week rule patients that we see in clinic. I think, as you're all probably aware, with the hospitals, it's normally things like parking and other things, buses and everything else that kind of normally makes those delays. And not being able to give you an appointment when you need one. We really urge you to contact any of the teams if you are delayed in your appointments, and it's something, again, that we feel we're failing at and have not much control over. It all comes from booking, and it's something that we would really urge you, if you haven't come for an appointment or nothing's been sent, please do get in touch, and we will try and see you as soon as we can.
Transport's chaos, so we know that transport doesn't turn up, then it does turn up, then you're waiting for 4 hours to get home again. It's not good enough. You need to tell us about it, and we will act as your advocate to try and make things better. But again, we have little sway. Having no notes is a thing that happens regularly in Gloucestershire. We've just changed the computer system to something that is going to make it brilliant. But it doesn't order notes. So that's super frustrating, and I realise how horrid that must be. You pitch for an appointment and go, we got no notes. We do our best. Sunburn. And there are a section of patients that will always ask us to look at something random on the person they've brought with them. It's really hard to do that. And it's also hard for us to turn you down. We try and do it nicely, but we don't like looking at your mate's leg. So we like it when you leave our appointments happy, even if it isn't going our way. Happy for us means you get it, you understand, you've got enough information, you will come back to see us, you feel confident in our care. Bringing your problems to appointments, bringing, maybe a little prep before you come to your appointments. Right, I've got to ask this has changed, rah, rah, rah. So the app on the phone is a cracking thing because it's concise and it's simple. And when you understand that we might run late, because we're not running late because we're not doing it, it's because there's someone with us that really needs that extra time. So it's lovely when you get it. And so many of our patients go, it's absolutely fine. I know when I needed an hour and 10 minutes and you gave it me. But I think when you're new in the system, sometimes that's bring a book, bring some tea. So sharing of concerns is super important, and patients who share their experiences with others. We do a little bit of buddying up in Gloucestershire. We haven't got a specific support group locally, but we love it when patients buddy up and actually share their time, and families who share concerns as well, and also being proactive about changes to your lifestyle, stopping smoking, losing weight, having a healthy, balanced diet, doing some exercise, wearing some sunscreen is lovely. And being nice to us is good too. So these are just some information advice, things that we also do through appointments. We're lucky enough to have a Maggie's Cancer Care Centre just down the road in Cheltenham, and we're referred to there. And Charlie's is another cancer support group in Gloucester. We are delighted with the patient decision aid that Melanoma Focus have just distributed. It's going to make a big difference to how you guide your care, and also interacting with skin. We'll teach you how to examine your lymph nodes, what to look out for, and to be sun aware. And also get you involved in sun awareness at work and at schools as well. We'll give you advice regarding financial issues, and we've got some great Macmillan financial advisors in Gloucestershire who are really helpful to us. And knowing your rights about free prescription, pensions, travel insurance, etc. I think in our clinics, we very rarely, in our dermatology clinics, see people on treatment for appointments. Those tend to be our supportive oncology appointments. But again, we are aware of the need to have your questions about treatment side effects answered. And we will always make sure when you leave our appointment, you have our contact details. You have our email, you have our phone number. You know where you can hunt us down. So these are some of the other referrals that we will do, depending on need. And some useful websites and some pictures, and that's it. Thank you.